Okay, hi guys, it's Ashley Plum and Ashley Cox, and today we're going to be going over intellectual disabilities. So let's get started.
Okay, so I'm going to just be discussing the introduction, kind of the definition. According to AAID, which stands for the American Association on Intellectual and Developmental Disabilities, an intellectual disability, also referred to as an ID, are defined as significant limitations in intellectual functioning and adaptive behavioral skills in three categories: conceptual, social, and practical. And then the book says with an origin before the age of 18. So conceptual skills, those are things like language, reading, writing, those kinds of things. Social, those are just kind of communication sort of things over like that. And then practical, those are just things like safety, things that you need to know with people with an ID, their functioning towards those kinds of things are limited. And I found this topic very interesting. I work at Journeys. It's a developmental disability agency here in Rexburg. And I work with clients with disabilities ranging from Down syndrome to infantile spasms to cerebral palsy, spina bifida, and even autism. I mean, just a very broad spectrum of disabilities here. So.
All right, so when we were looking at this chapter, we were a little confused because it sounded like individuals with intellectual disabilities could also constitute as someone with a developmental disability. So we wanted to explain the difference between these two, and what the book gave us as a definition is there are two main reasons as to why developmental disability is different from an intellectual disability. The first one being that an intellectual disability is present at birth, while a developmental disability can manifest itself up to the age of 22, which isn't necessarily true because, as we explained before, an intellectual disability can come or manifest itself up to the age of 18. The second reasoning that was given is that intellectual disabilities are low in IQ. An individual who is diagnosed with an ID needs to have a low IQ, while however someone with a DD or a developmental disability doesn't need to have a low IQ to have an intellectual disability. So a little confusing, but this is what we were given in the book to help explain the difference between these two disabilities.
Okay, so like Ashley was just saying, so an IQ level is really important for an intellectual disability. So here we found from the book a little table that was kind of helpful for us. So they kind of rate the degrees of severity based on the IQ. So basically for mild, anywhere from about 50 to 70, if their IQ range is about there, they rate about a mild intellectual disability. For moderate, their IQ ranges anywhere from 35 to about 55, just somewhere in there. That's about moderate. A severe level of intellectual disability is anywhere between kind of like 20 and 40, anywhere sort of in that range. And then profound, that's pretty much anything 20 or 25 below is considered profound. And something very interesting that we talked about and that we read about was that an individual with a profound level of cognitive impairment often exhibits secondary impairments, such as seizure disorders or cerebral palsy, and represent the smallest portion of persons with an intellectual disability. And as I work at Journeys, I see this all the time. We don't really have very many profound cases, but we do have a couple, and it's interesting with those how it just how they have sometimes they have multiple impairments as well. So.
Mm-hmm. So we also found this other chart which kind of explains a little bit more as to what exactly happens to someone who has either a mild ID down to a profound ID. So we'll just take a look at that. If you look up at the top with mild, it says about 85% of the ID population have a mild case. Now, individuals who have a mild case can generally learn reading and writing and math skills between third and sixth grade levels, and they may also be able to have jobs and live independently from caregivers. Now, down to moderate, about 10% of the ID population have a moderate case. They may be able to learn some basic reading and writing skills, and they also may be able to learn functioning skills such as safety and self-help. However, they will require some type of oversight or supervision. If we move down to severe, about 5% of the population have a severe case of ID. With this, they probably will not be able to read or write, although they may learn self-help skills and routines. They will also require supervision in their daily activities and living environment. And lastly, down to profound, about 1% of the ID population have a profound case. Now, with profound, they require intensive support and care. They may be able to communicate by verbal or other means like technology through iPads or some other form of communication. And they may have medical conditions that require outgoing nursing and therapy, but they also will require intensive care and supervision around the clock. So here's just an example of the difference between a mild down to a profound case of an ID.
And here we have specific needs. This was kind of a difficult one because, like with all of the disability presentations we've seen, every single disability is different, the severity is different, and so based on kind of wherever somebody's at with whatever disability they've got, it sort of just depends. Here were a few things that we found that we thought were important, which we wanted to include. The first is the degree of intellectual disability determines the extent to which cognitive behaviors are impaired. The development of functions such as auditory and visual memory, the ability to understand abstract concepts may be delayed. Impining stimuli easily distracts clients, and generalization and transfer of learned behaviors from one experience to another is less spontaneous. And articulation and expressive language problems also interfere with the learning process. The ability to follow a logical thought pattern, to evaluate an activity, and to use problem-solving approach to acquire new skills. So with those different needs comes different types of care. And so the needs they range anywhere. It's huge. It's very broad.
All right, down to testing, equipment, and medication. So for testing, you can do an IQ test, but there is rarely one cause for an intellectual disability since it may occur at any time during the first 18 years of life. As we explained before in the beginning, causes are grouped according to the time when they are manifested in an individual's life. So they turn it into three categories. So the first one is prenatal. Prenatal meaning occurring or existing before birth. And some examples in the book includes chromosomal disorders, metabolic errors, brain formation disorders, and environmental influences like alcohol and drug abuse during pregnancy. Now, after that, we have the perinatal period, which is occurring from the 28th week of pregnancy through 28 days following birth. Now, some examples they give are head trauma at birth, abnormal delivery, and infections. And lastly, we have postnatal. So this is any time after birth up to the age of 18 in particular, or even further throughout an individual's life. And the examples given for that includes head injuries, infection, degenerative disorders, seizure disorders, malnutrition, and family and environmental causes like child abuse or neglection.
Here we have some resources. Now, developmental disability facilities like Journeys, that includes forced services, and Journeys provides these forced services. There's interdisciplinary training. And that kind of just depends on what the client needs. That can be in the home or in the community. It's all depending on what the client needs. Habilitative supports, which is what I do, and I take the client out into the community. We work on goals out there, integration, communication. The goals can range anywhere from using the potty and keeping their diapers dry, to crossing the street, to talking to a stranger but using eye contact. So going out into the community and using the community as a resource is very important. The next service is called respite, and it's kind of just like glorified babysitting, I suppose. We have the kids come to the facility. We do respite parties, which we show a movie, and there are some treats. And basically, respite is for the parents mostly. It just gives the parents a bit of a break. With my job, we have some clients. There are 4 of them, and they all have very severe intellectual disabilities. So the Saturday night that we do this respite party, the parents go on a date because they need a date after working with those kids all the time. It's just really hard. So respite is really for the parents, to give the parents a bit of a break. And then habilitative interventions, those are just things like family training, getting along with siblings, learning to eat with a fork where you stab your food before you put it in your mouth, learning to pull your underpants up after using the bathroom, different things like that. And then obviously we cannot forget teachers, teachers' aides, and special needs helpers, which help in the school system, and they are amazing and we love them so much.
All right, and lastly, the TR I can't pronounce that right. Implications, there we go. So therapeutic recreation interventions with people with intellectual disabilities. This emphasizes a balanced leisure lifestyle, decision-making skills, leisure skill and resource development, selection and participation in age-appropriate experiences, inclusion within the community, physical well-being, community safety skills, communication, and fundamental leisure experiences. So we did have a video to show you guys, however we are running a little bit over on our time. There's just a lot of information. We're just going to pass that. We'll include it also in the discussion board in case you want to take a peek at that.
And it's awesome and you should watch it because we love it.
It was really good. But for the purpose of time, or the sake of time really, we're just going to go ahead and end there. Here's our bibliography. We hope you enjoyed this. If you do have any questions about this, please again feel free to add something down in the comments in the discussion board. All right, we'll talk to you guys later.
Bye.